All right, great. So let's jump into the toxicities and see how to assess these. Assess these toxicities. So let's start off with constipation. So mark all of the symptoms that you have. No daily bowel movement, painful bowel movements, hemorrhoids, pebble-like hard stools, straining on the toilet, abdominal bloating, foul-smelling gas, early satiety, which is basically a lack of appetite due to feeling of fullness. The main symptom on here is the no daily bowel movement. So laboratory tests to do? None, based on symptoms only. Laboratory data is also none. And then in my experience, it is very likely that someone has constipation if they have 2 or more of the above symptoms, including the lack of bowel movement per day. Okay, so then conclude for yourself, yes, I believe I have this cause, or not. And if you say yes, go back up to page 2 and mark it off. Next up is mold. So please mark all the symptoms that you have. So fatigue, muscle weakness or cramps, joint pain and stiffness, sinus issues, so postnasal drip, nosebleeds, very cardinal sign, sinus congestion, chronic sinus issues, sinus inflammation, chronic cough, headaches, including migraines, tinnitus, or basically a ringing in the ears, itchy ears, ear drainage or fullness. Oftentimes people will report having a fullness in their ears, or hearing loss. Oftentimes people with gastrointestinal issues, so bloating, irritable bowel, diarrhea, and gastroparesis, which is basically like a neuropathy or a nerve issue having to do with the gut, because mold and mycotoxins are neurotoxins. So they're toxic for the body, and any place that you have a toxin that it is affecting a nerve can happen really anywhere in the body, and that's kind of what we're seeing here. These mycotoxins will also irritate the lining of the urethra and the urinary tract, so you'll get urinary symptoms like pain with urination, increased urination where you feel like you're urinating all the time, and excessive thirst. Mold and yeast will feed off of each other, and so you'll get an increase in vaginal infections, including vaginal yeast infections. Or I should say, yeast infections, including vaginal yeast infections. And some other neurologic. So this is the nerve. These are the nerves in the brain, causing dizziness, disorientation, tremors, paralysis, numbness, and tingling. This also includes the how the mycotoxins trigger the immune system. So the immune system in autoimmunity loves to attack the brain in certain parts, including the cerebellum, which has to do with balance and orientation. And so you'll get problems with that. Mood swings is a big one, anxiety, depression. Brain fog is a big one, problems with attention, learning, and memory. People can have vertigo, a metal taste in their mouth, mold sensitivity, so reacting to moldy places. If you walk into a house or a building and you smell mold, or you immediately start to feel a tingle or brain fog in the sinuses, you know to leave that space because you're being exposed to mold. And then the testing to do, looking for mold in your body, is going to be the GPL mycotox or the urine mycotoxin test. It needs to be provoked with ready-sorb liposomal glutathione, 450 milligrams, twice a day for 7 days prior to testing if you're able to tolerate glutathione. If you start taking liposomal glutathione and you start to feel badly, immediately stop the glutathione and just do the test at that time, because that indicates that you're flushing a lot of the toxins out of your lymph and other parts of the body into the bloodstream, and you're just feeling worse because you're being re-exposed to it and your body's not able to get rid of it because you're pulling it out and not able to get rid of it. So that is what that is. So, and then the ERMI, the Environmental Relative Moldiness Index, is a great test. It looks at DNA of the mold in the home, so you can test your environment for mold. And then if we need to know exactly where the mold is, since the ERMI basically does a whole space, you're basically taking collections from throughout the space. ERMI really is the best test. If the ERMI test is above 2, is significant for pathologic mold or disease-causing mold in the space. And so we use, if we're trying to determine exactly where it is, it's too expensive to do the ERMI for each test or each section of the home. And so using something like the Immunolytics mold test plates, which is looking more at mold spores, which is a less expensive option, and you can put the petri dishes out in certain parts of the home. It doesn't look at mold toxins, but or mycotoxins or the DNA, but it does look at the mold spores, which can give you an idea. Now, if there's just mycotoxins present, there's just DNA present, then you're not going to get anything positive on the immunolytics test. However, you've already done the ERMI, you know that it's present. So then you just need to have somebody in to look at, what are the moisture readings behind the doors, or behind the walls rather, where is the mold, where is the leak that you need in order to be able to determine where the mold is. And then the laboratory data is elevated levels of the mycotoxins in the urine according to the lab test, the ERMI greater than 2, and the mold test plates positive. Education. In my experience, it is very likely that someone has mold toxicity in their body if they have 2 or more of the above symptoms and the elevated levels of urinary mycotoxins. The asterisk symptoms are especially indicative of mold toxicity. Sometimes the urine mycotoxin test is normal, even if someone has mold toxicity and the test is provoked with glutathione. So very important. This occurs if their detoxification pathways are clogged. In these situations, doing the test without provocation or treating based on symptoms is advised. Here's the conclusion. Choose yes or no and proceed. So next up, heavy metals. So all these symptoms, headaches, fatigue, neuropathies, so once again, numbness and tingling, or nerve pain, muscle pain, joint pain, brain fog, memory loss, anosmia or loss of smell, depression, high blood pressure, history of mercury, silver fillings in the mouth, either they're still in the mouth or even if they've since been removed, and then a history of playing with mercury as a child. So for me, I had a lot of muscle pain which went away when I started getting rid of my mercury. So the laboratory test to do is the doctor's data toxic metals urine test, and we provoke it with DMSA, which is a very big sulfur compound that pulls the heavy metals out of the tissues into the bloodstream so that they can be collected in the urine for the next 6 hours. And the way to provoke it is 10 milligrams of the DMSA per pound of body weight. So a 150-pound person will need 1,500 milligrams of DMSA. And then laboratory data. So heavy metals excreted in urine with a DMSA provocation that is 10 times the baseline levels or elevated by laboratory values. And so basically if it shows up as being yellow or red on the laboratory value, that's considered significant, or 10 times a pre-provocation. So most of the time it really depends. If we presume heavy metals and for some reason we get a normal test, we may want to do a pre-test to double check it, because if the pre-test is like 0.1 and the post-test or the test after provocating with DMSA is 1 is not going to show up as positive. It'll show up in the green, meaning that it's normal. But the fact that it's 10 times the pre-test makes it significant. So that's where doing 2 of these tests would come in handy. Education. In my experience, it is very likely that someone has heavy metal toxicity if they have 2 or more of the above symptoms and the elevations on urine laboratory testing. And then conclusion section, make your determination. Yes or no. Chemicals. Please mark all the symptoms you have. Very similar to the heavy metal symptoms. Headaches, fatigue, neuropathy, muscle pain, joint pain, brain fog, memory loss, anosmia or loss of smell, depression, and type 2 diabetes. Pesticides very quickly becoming a major cause of type 2 diabetes. And then the testing to do would be the GPL tox urine chemical test, as well as the GPL glyphosate test, which is looking at the main ingredient in Roundup. Now, both of these tests need to be provoked with the ready-sorbed liposomal glutathione, 450 milligrams twice a day, which 450 milligrams is a teaspoon, by the way, twice a day for 7 days prior to testing. If you're able to tolerate glutathione, once again, if you're doing it and you feel worse and you can't tolerate the glutathione, just go ahead and do the assessment on that day or the next day. So laboratory data, elevated levels of chemicals excreted in the urine with a glutathione provocation, or without. But elevated levels are significant. Education. In my experience, it is very likely that someone has chemical toxicity if they have 2 or more of the above symptoms and the elevations unprovoked urine laboratory testing. Conclusion. Make your determination, yes or no. Stealth infection. So what I've done here is included symptoms for a lot of the different stealth infections, and then in subsequent assessments, I go into each one of the stealth infections. So if you have insomnia or sleep problems, if you have fatigue, if you have cognitive dysfunction like brain fog or memory loss, urinary symptoms, either pain with urination, urinating at night, urinary urgency, where basically when you think about urinating, you have to urinate, or when you know you have to urinate, you have to do it now, and frequency, meaning you urinate a lot. Temperature changes, so cyclical fevers, day or night sweats, cold hands and feet, and muscle pain, so neck pain, headaches, muscle cramping, especially in the calves and feet, and foot pain. Joint pain, so joint pain that moves around the body, it's migratory, so one day it might be in the elbow and the next day it might be in the wrist. And non-migratory, so some that just stay in one joint. Knee, foot, hand, hip, shoulder pain. Mood issues, so depression, anxiety, and then more severely, panic attacks and suicidal thoughts. Neuropathies, so numbness, tingling, shooting pains, electrical shocks through the body. Hormonal deficiencies like adrenals, thyroid, sex hormones. Symptoms that move around the body and change in quality from day to day. That's an important markers we'll talk about in a little bit. And then the tests to do are going to be the multiple pathogen immunoglobulin blood test. And so that's looking at a lot of the viruses, and that's looking at, it's a serology test, so it's looking at the immune system's reactivity to these bugs. And you want to do and the DNAconnections.com test. So the Lyme panel, that is a urine PCR test. That test is the only test that's not found at orderlabs.fixyourfatigue.org. Now that Lyme panel does need to be provoked with either a lymph massage or 30 minutes of exercise just prior to collection. And then the laboratory data, so if you've got elevated immunoglobulin, so if the immune system is reacting to those these different bugs, Epstein-Barr, mycoplasma, chlamydia, cytomegalo, human herpes virus number 6, that's considered significant, and we'll get more into that and those specifics. And then the presence of Bartonella, Babesia, Borrelia, or Ehrlichia on the urine PCR test through DNA Connections. So education. In my experience, it is very likely that someone has a stealth infection if they have 2 or more of the above symptoms and the indications on laboratory testing. So to determine which infection you may have, please proceed to the next sections that go into more detail on the individual infections. And then conclusion, determine yes or no if you believe you have a stealth infection, and then we'll get into more specifics so you can determine exactly which one you have. So let's start with Borrelia burgdorferi, otherwise known as Lyme disease. Not Lyme's. Oftentimes people say Lyme apostrophe S. It's just Lyme, as in Lyme, Connecticut. So please mark all the symptoms that you have. So fatigue. And then these are really the cardinal signs. So symptoms that come and go. So you've got good days and you have bad days, and they're really dramatic. And then symptoms that move around the body. So you can have joint pain, muscle pain, or nerve pain that moves around the body, really depending on the moment or depending on the day. So if one day you've got elbow pain, that's really bad, and the next day you have wrist pain, it's kind of moving around the body, and some days are good and some days aren't good, then that's really characteristic and pathognomonic, almost diagnostic for Borrelia burgdorferi. You can also get a rash, and it can be worse around your menses. So doing that DNAconnections.com Lyme panel urine PCR test with the provocation that we talked about really is the best test. And that provocation, just as a reminder, the lymph massage or 30 minutes of exercise, what it's doing is you're pushing all of those bugs out of the lymph system into the bloodstream so that it can be collected in the urine. And it's good to actually do this provocation as well before you do the blood test, the multiple pathogen blood test through Cyrex as well. Good, because you're going to get more of a chance of getting a positive response, which is really what we're looking for, because these bugs really love to hide. And we really want that direction. So the laboratory data is the presence of Borrelia on urine PCR testing and education. In my experience, it's very likely that someone has a Borrelia infection if they have both of the asterisk symptoms above. This can be confirmed with the urine PCR test, but is not entirely necessary. So even the Centers for Disease Control in Atlanta talk about these infections as being clinical diagnoses. So they are more based off of the symptoms that you have and the signs that you have instead of a lab test. And a lot of that has to do with the fact that the Western blot test, which is the immunoglobulin test for these infections, was really for epidemiologic studies only. It wasn't for diagnosis, it was just for research. So pay closer attention to the symptoms, and then the urine PCR test is going to be confirmatory. So make your determination and move on to the next page. So here's ehrlichia or anaplasma. So symptoms, please mark all of the symptoms that you have: high fever, headache, fatigue, musculoskeletal pain, so body pain. And the test that you're going to want to do is you're going to want to do the Fix Your Fatigue blood panel and the DNA Connections Lyme panel, the urine PCR test with the provocation. And the reason why you want to do both is because there are quite a few markers in the blood when you're looking at normal lab tests that are going to suggest these infections. So a low white count of less than 4, a low platelet count of less than 150, elevated liver function tests, and then of course the presence of the ehrlichia and the anaplasma on the urine PCR. So, we're putting together all of this information in order to determine which bug is present that's causing a problem. And in my experience, it's very likely that someone has had an ehrlichia or anaplasma infection if they have 2 of the symptoms above and all of the laboratory data. The urine PCR test will help differentiate between the 2 of them. And so I shouldn't have written that last line because ehrlichia and anaplasma pretty much are they're the same bug, they're just known by different names. So make your determination whether or not you feel like you have ehrlichia or anaplasma. Okay, Babesia. So here are the symptoms of Babesia. So day sweats and the person runs hot. So this is, if you find that you're always the warmest person in the room, it's 20 degrees outside and you want to go outside without a jacket on because you're always running so warm, or you spontaneously break out into a sweat, either day sweats or night sweats. You'll have chills oftentimes because you'll be sweating and you'll experience that. You'll have lung issues like air hunger or shortness of breath, where basically you can't catch your breath, and a cough that can't be explained. I've seen numerous times where people come in, they have this chronic cough, can't explain it, turns out they also have sweats. We treat Babesia and it goes away. Fatigue, abdominal pain, interestingly enough, diarrhea, because Babesia can get in the gut. Anxiety and panic attacks. So oftentimes their mood issues are quite severe, more severe than Borrelia or than Bartonella, where anxiety can progress to panic attacks and depression can progress to suicidal thoughts and suicidal actions. And then awful insomnia. People will have really bad insomnia. So the laboratory test to do is DNAconnections.com. And that is the Lyme panel, the urine PCR test with the provocation. And what you're looking at is the presence of Babesia on that test. And in my experience, it's very likely that someone has a Babesia infection if they have both of the asterisk symptoms above, and that those are the lung issues and the sweating. And the other symptoms can be confirmed as well as the urine PCR test. And make your determination. or I should say, the other symptoms can be confirmatory as well. I think I said confirmed. Confirmatory as well as the urine PCR tests. So they can be supportive of figuring out whether or not you have that bug. So Bartonella henselae. So the symptoms include cold hands and or feet. So oftentimes this will persist even after we fix somebody's thyroid. They'll still be cold. And this is because Bartonella likes to live in the blood vessels as well as in the skin. So you'll see that there'll be symptoms associated with both of those. So occasional fever, sometimes this is every couple of days, every couple of weeks, but occasionally at night. And they may have some sweating and some fevers, but it's not as extreme as Babesia. They'll have fatigue, they'll have soreness, sharp pains, or discomfort on the soles of the feet where they feel like they need to wear slippers all the time, oftentimes misdiagnosed as plantar fasciitis. Sharp shooting knife-like headaches. They'll have joint pain, usually in a single joint, oftentimes wrist, hands, thumb joint is a really significant one. Sometimes elbow, hip is a big one, sometimes ankles. It can be multiples, but usually there's just one joint that's quite bad. Muscle pain can be severe. Oftentimes these people have been diagnosed with fibromyalgia because of the pain in the muscles. Neck pain, low back pain. It's important to remember what the actual mechanism here is for all of these bugs, is that the bug is present and the immune system is trying to get rid of it. And in order to do that, the immune system mounts a reaction and an inflammatory reaction. So the inflammation comes, all of these bugs come from all around, immune system's like, hey, come help me. Here comes the immune system, and it goes to attack the bug, and it's not able to get rid of the bug because the bug is usually hiding someplace. Let's say Bartonella is hiding in the thyroid. The immune system is trying to get at it, and in the process, it is destroying the thyroid as it's trying to get at the Bartonella, and that's Hashimoto's. So any sort of it's trying to get at it through the muscles. You're going to get a myalgia, or basically inflammation in the muscles. So once you remove the Bartonella, then there's nothing to attack anymore, and that's what quiets down the inflammation and the pain. So insomnia can come from Bartonella. You can get stretch marks in weird places. Oftentimes people have them on the flank, and they'll be like, why do I have that? Unrelated to pregnancy. They'll get muscle cramps typically in the calves at night. They'll have thyroid issues, so hypothyroidism and Hashimoto's. They can have anxiety and depression. They can have high blood pressure because of the inflammation that they have in the blood vessels. And then they can have Raynaud's, which has to do with when you go outside in winter, your hands will turn white because they get so cold. And that has to do with the fact that the Bartonella is in the blood vessels, causing it to spasm and shut down so that you're not getting enough blood flow to the hands. So laboratory testing to do is that DNAconnections.com Lyme panel, the urine PCR test, with provocation. And positive is considered when Bartonella is found in that test. So in my experience, it's very likely that someone has a Bartonella infection if they have both of the asterisk symptoms above, and the other symptoms will be confirmatory as well as the urine PCR test. So those that I marked off is the pain in the feet, muscle cramps, oftentimes one or two of the others, but putting it all together is key. And sometimes people have just one of those symptoms, but it can be significant enough. So make your determination and move on to the viruses. Epstein-Barr virus, cytomegalovirus, and HHV6. So you can get fever, swollen lymph nodes, fatigue, memory loss, brain fog, with the lymph nodes being the big one. And you'll want to get the Fix Your Fatigue blood test as well as the multiple pathogen immunoglobulin test. And like I said, I would recommend provocating it with the lymph massage or 30 minutes of exercise. And then the laboratory data, high white blood cell count during the acute phase of these infections when white blood cell count is greater than 10, or a low white blood cell count during chronic infections where the white blood cell count is less than 4. You can get high lymphocytes, which fight off viruses and monocytes as well. In chronic infection, sometimes you'll get low neutrophils, which usually fight off bacteria. So you get this shift. There's a certain number of cells that can be made by the bone marrow for immune system function. And oftentimes, depending on what the need is of the body will shift its production to be making more lymphocytes against the viruses or more neutrophils against an acute bacterial infection. And high IgG and IgM titers on the blood serology test. And there are different ways to kind of interpret this. Oftentimes, so the IgM test or the IgM serology is the first time that you ever see a bug, first time you ever see Epstein-Barr virus, the IgM is going to react. And so that's how you know it's the first time that you've seen it. Then it sends a message back to the IgG and says, hey, I just saw this Epstein-Barr virus. I got rid of it. You got to remember because you react a lot faster. The IgM is big and bulky. The IgG is a lot faster. So that the next time it sees Epstein-Barr virus, it's going to react even quicker. So if you see an IgG, oftentimes it can indicate a memory or basically, hey, you've seen this already. But it can also indicate if it is reacting to it. It can also indicate that it is a chronic infection. So there are some more nuances to that. But if you're seeing elevated levels of IgG and IgM, you definitely want to consider treatment because the verdict is still out. There is research on it, and I've explored a lot of it, but the verdict is still out about exactly what these numbers mean. But if either one is elevated, it's definitely something you need to explore. Either one being IgMs and IgGs. And in my experience, it's very likely that someone has an Epstein-Barr virus or other chronic viral illness and infection if they have swollen lymph nodes with some of the other symptoms. Blood serology testing is confirmatory, so that helps to confirm. Very helpful. And then just another side on the IgM. The IgM also can reactivate. So even though I said it's the first time generally that you see it, sometimes it can reactivate so that you're seeing it then again for the first time. Does that make sense? Again for the first time. Okay. So make your determination, and we'll move on to the next. Sinus infections. So you can get symptoms like fatigue, runny nose, sinus congestion, postnasal drip, ear congestion, which we talked about also with mold, right? Loss of smell, sinus headaches, and facial pain or pressure from sinus congestion. The laboratory test to do, if you are going to do a test, is going to be the Marcon's test. And Marcon stands for multiple antibiotic resistant coagulase negative staph. So this is a staph infection, a gram-positive organism that gets lodged inside the sinuses that oftentimes is really stubborn and is resistant to antibiotics. That's why it's great that we use herbs exclusively to get rid of the crap that's up in there. And then the test would be a positive Marcon's nasal swab test. In my experience, it's very likely that someone has a chronic sinus infection if they have 2 or more of the above symptoms, including 1 of the asterisk symptoms. The Marcon's nasal swab test is confirmatory and especially helpful if initial treatment was unsuccessful. So normally I don't test the Marcon's test initially. I will usually treat before I do so. And if I'm not having success, then as I'm adjusting my treatment and whatnot, I may consider to do this test to give me some more guidance. It also will look for mold in the sinuses, yeast in the sinuses, and other bacteria besides the staph. Make your determination and move on to the next cause. So intestinal infections. Symptoms include fatigue, constipation, diarrhea, reflux, bloating, flatulence or gas, abdominal pain, hemorrhoids from the constipation, skin rashes, chronic itching, specifically in and around the anus, the ears, or the skin, sugar cravings and symptoms worsening with sugar consumption, joint and body pain, sinus congestion, and brain fog. So in a lot of these, well, we'll talk about that in a second. So the best test that I have found is the GI MAP test by Diagnostic Solutions, and that's a stool test. And then, a lot of these symptoms that I mentioned up here, they can be due to bacteria, parasites, or yeast. So sometimes they're more than the other, but I have been fooled. So chronic itching oftentimes can be yeast and or parasites. Sugar craving, yeast and or parasites. Brain fog, oftentimes any of them. Sinus congestion, yeast is the big one. Constipation can be any of them. Diarrhea can be any of them. So um, having this test is very helpful. It's not great, and there's no test that's really great at picking up parasites. So sometimes that is a diagnosis of exclusion. So education, in my experience, it's very likely that someone has a chronic intestinal infection if they have 3 or more of the above symptoms and positive laboratory stool tests, which means that they find something on the stool test. That said, parasites don't show up regularly in stool tests, so treatment is typically based off of symptoms, and if we're not finding anything else that is significant. The other thing that can be helpful is if we do a provocation, if for some reason the stool test is not working right, and that provocation is basically magnesium to make sure that you're getting a good evacuation, especially if you've got constipation. One of my favorite things to use is magnesium to bowel tolerance. So you increase the magnesium, and then you're able to have a nice regular stool, because oftentimes these bugs will hide, and I get the impression that they kind of scurry back up. And so the quicker transit that you have to kind of remove the stool from the body, the better testing you're going to have. So conclusion, make your determination, and if it's a yes, add it to page 2. So dental infections, please mark all the symptoms that you have. So fatigue, history of a root canal, even if it has been repaired, because a root canal basically is just an artificial canal that can be can create a chronic infection even if you don't have any pain. These are very insidious. So sometimes you can have pain in the gums, sometimes not. Sometimes you have periodontal disease, sometimes not. History of a broken tooth, history of a dental cavitation or dental infection, history of a wisdom tooth extraction. So oftentimes these can lend themselves to identifying this. A dental thermogram can be very helpful at determining whether or not there are any infections in the gums. And a positive test on a dental thermogram would indicate that there is an infection up in the sinuses, or not in the sinuses, in the gums. In my experience, it is very likely that someone has a chronic dental infection if they have 2 or more of the above symptoms and a positive dental thermogram. That said, you may have none of the above symptoms except fatigue and a positive thermogram. So that should be positive. And sometimes if you don't have access to a thermogram, sometimes it's just fatigue. And so we do the best that we can with the testing that we have. But oftentimes there are things that need to be done. Sometimes root canals need to be removed because they may have chronic infections. And there's a whole conversation around that and utilizing other things like dental implants. So make your determination, and let's move on to food allergies or food toxicities. So these are some symptoms that you can have when you have food allergies: fatigue, constipation, diarrhea, reflux, bloating, flatulence or gas, abdominal pain, skin rashes, itching, joint and body pain, sinus congestion, brain fog. A lot of this, including the skin rashes, has to do with the immune system's reactivity to something. And remember, when it's reacting to something, it causes inflammation. And the body, with a lot of these things, the body is just trying to get rid of whatever is causing the problem. And the inflammation gets out of whack and gets stuck in the on position, and that's when you get pain and dysfunction. So the testing that we want to do the food elimination diet. So you remove the foods, usually the top 10 food allergens, for 3 weeks. And then you reintroduce 1 new food every 4 days. I do like to separate out different classes of foods. So for dairy, you would introduce different kinds of dairy. Now, if you react to something, then you remove it, and you have to get back to baseline until you introduce the next thing. The IgG food allergy test, blood spot, is optional. I haven't found these tests to be especially good, but if you really want that data, sometimes it can pick up something that can be helpful. And so the objective data is the reaction to the food upon introduction. So when you're doing after you've done the food elimination diet, when you reintroduce it, it's called the oral food challenge test. You're basically challenging your body. It takes 3 weeks to get your immune system to stop reacting to something. So then if you introduce it, let's say you're introducing dairy. Let's say you love ice cream. So you have an ice cream party on day 1 of introduction, and then you wait day 2, day 3 before you introduce something new on day 4. If you react in those days, it's due to the ice cream. Okay, so that kind of gives you an idea about, and that's pretty darn objective data. You just have to pay attention because you're going to get the message. You're going to get constipated, you're going to get a skin rash, you're going to get acne like I did. I had bad cystic acne growing up from dairy. So there's all sorts of different things that can pop up. And in my experience, it's very likely that someone has a food allergy if they eliminate the food for 3 weeks, then reintroduce it and experience negative symptoms. This is the gold standard for food allergy testing. Blood test is complementary, but not very accurate. So make the conclusion. One other nuance to that is that gluten oftentimes has to be out of the body for about 3 months before you add it in. And remember, there's a lot of gluten mimickers, proteins that look like gluten to the body. So oats need to be eliminated. Even if they're gluten-free oats, sometimes they are still not good for an individual. So things to pay attention to. And there is some additional testing that can be done to determine whether someone has some cross-reactivity with gliadin or gluten proteins. So make your determination, and let's move on to inhaled allergies. So these are things like pollens, animal dander, molds, grasses, all sorts of things that are out in the environment. So you can have fatigue, sinus congestion, headaches, migraines, skin rashes, itching, joint pain, body pain, brain fog, systems worsen according to the seasons. So somebody will start sneezing a whole bunch and they'll say, oh, it must be cedar time or something like that. I know my family has a really hard time with cedar in Texas. Symptoms improve when taking antihistamines and other allergy medications or supplements. So things like butterbur is a great supplement for that. But if they start taking it and they're doing better, it indicates that what was probably happening was they were having a reaction. It was probably an allergic reaction. You can also use these with foods as well. And really any symptom can be caused by these allergies because the immune system is everywhere. Inflammation is everywhere in the body. So you can pretty much get any symptom from an allergic reaction. Symptoms improve in different parts of the country. Like, if you're reacting in Texas and then you leave and you're no longer reacting, you know that you're reacting to probably something in that area. Though it could be there's something in your home like mold, or maybe you've got some sort of exposure at work. So important to be the best medical detective you can be. Symptoms improve outside the home. So once again, animal danders and molds, if you've got an animal in the home. So the tests to do, there is something called a RAST, R-A-S-T, IgE blood test that you can get locally from your doctor, and then a skin prick test, which your local doctor or allergy doctor can do as well. Now, the skin prick test can work for inhaled allergies, but it does not work at all for foods. And you'll see that your allergy doctor will also try to do it for foods and tell you that there's something, that you're not allergic to any foods because nothing shows up. This is only testing IgE, which only tells you basically about anaphylactic reactions. It lives on the skin. It's different than the IgG test that we would do for foods if we were to do a test. So positive reaction to the RAS test and the skin prick test are significant laboratory data. And in my experience, it's very likely that someone has an inhaled allergy if they have two of the asterisk signs above and 2 other symptoms. And laboratory testing is confirmatory. Make your determination, yay or nay. So negative emotions, this is a very important one, and one that Stacy would do more justice to. But there are a lot of symptoms that can be associated with negative emotions. So fatigue, I myself, suffered with, a number of ACEs, which we'll talk about in a little bit, adverse childhood events growing up, and that has influenced the way that I see the world and how oftentimes I will shift to shame, and that really does not help out with any of my relationships, but that has played a big role in my fatigue. Negative self-talk, self-criticism, not living in alignment with one's belief, feeling trapped in one's life, inability to forgive, perfectionistic tendencies. This is very common in people with fatigue. Major loss in your life at a young age, trauma at a young age, separation from parent at a young age, difficulty sleeping and insomnia, physical symptoms with no apparent cause, anger that is difficult to control, difficulty quieting the mind, obsessive compulsive behaviors, loss of sexual desire, difficulty making decisions, brain fog or memory issues, difficulty tolerating social activity and a need to avoid others, erratic behaviors, easily agitated, mood swings, feeling overwhelmed, on the edge, or hopeless, having racing thoughts, engaging in risky behaviors to relieve stress or numb, withdrawal or isolation from other people, and increase in negative or difficult emotions. So these all can really contribute to fatigue. And then doing the adverse childhood events questionnaire, which we will talk about. And this test really, it doesn't have like a, some people say if it's above 4, then that's considered really significant. But any number that you have on there just kind of gives you some data around how much some of these adverse childhood events could be affecting your fatigue, could be affecting your life, and how, we all need to work on changing our mindset and developing an invincible mindset, a wonderful mindset, a happy mindset, in addition to changing the way that we see the world. So that's part of this whole journey that we're going on when you have a chronic illness, is really developing every aspect of you to be as healthy as possible. That is sometimes the gift of these illnesses, so that we can really develop a robust mind, body, spirit, emotion. And so we're going to talk about that more as we get into that chapter, into that module. Laboratory data, the elevated ACEs we talked about. And then in my experience, it's very likely that someone has negative emotions contributing to their fatigue if they have 2 or more of the above symptoms. And then ACE testing is supportive, but not entirely necessary. Make your distinction, yes or no. All right, this might be the last one. Electromagnetic frequencies. So anything that has a battery can emit a signal, electromagnetic signal. The mobile data on your phone, the Wi-Fi, the Bluetooth, any of these invisible rays which are coming off of the computer, and whatnot, can all be significant, can all damage DNA and cause problems. So they can cause fatigue, headaches, brain fog, memory loss, sleep problems, depression and anxiety, chronic pain, chronic infections. Symptoms worsen when using technology. Symptoms worsen when using Wi-Fi, Bluetooth, or mobile data. Symptoms worsen with proximity to power plants. So I've had clients who, they'll be driving down the road and they'll start to get neuropathy in their feet, which is not on this list, which should be neuropathy. They'll get like numbness and tingling in their feet, or pain in their feet or in their hands, and sure enough, they round the corner and there's a big power plant. So sometimes, and these people really are the harbingers of the problems that are going to be, amplified throughout time. If 5G really gets rolled out throughout a lot of these communities, this is really a barrage of, it's an assault on our systems, where it's really going to be damaging our DNA, our human frame, and causing inflammation to happen and pain and dysfunction. Unfortunately, there's no laboratory test that can be done. There are some things that you can use to measure, and we'll talk about that. The EMF tri-field meter I use to determine how big the EMFs are, the magnetic versus the electrical fields. And then in my experience, it's very likely that someone has EMF toxicity contributing to their fatigue if they have 2 or more of the above symptoms and 1 of the asterisk signs. So you can see those here. So make your determination, yay or nay. And that is it. That is the end of the ultimate assessment guide. So I hope that this has been helpful for you. And so take all this data that you have collected, all of those that you have yeses on, put them up on page 2, because then we will be taking that page 2 and we will start creating the plan that is needed, because that is the next step. Creating that plan to replace the deficiencies, and then we'll go on to step 3 to open up the detoxification pathways so that we can do step 4, which is remove the toxicities. Thanks so much for being with me, and I'll see you in the next video.